So if you're only missing one tooth, why a dental implant over a bridge, like a traditional bridge?
Yeah, so a bridge is 50-year-old technology,
Okay.
and you've got to buzz down the adjacent teeth so that you've got something to attach the bridge to. And it works, it's effective, they look good. But what happens?
You still do them, right?
We still do, and rarely. I
Okay.
would say 9 out of 10 times we place the implant.
Okay.
And what happens in 10 years when you get a cavity around one of those anchor teeth? And now
On the
you're
bridge.
on the bridge, and
Okay.
you can't see it when you take an X-ray. You can't see what's going on underneath the bridge. So now perhaps you're faced with losing that tooth, and the domino effect occurs, and all of a sudden you keep heading toward eventually having a denture. And versus putting a single tooth implant in there, which is super strong, can withstand all the forces of chewing that you can place on it, and you don't have to alter the adjacent teeth in any way. So it's a far superior
What about
restoration.
expense? I mean, in the long run, what costs more?
Yeah, so it's probably the most cost-effective way to replace a missing tooth, because you can expect 40 years plus out of a dental implant versus 8 to 10 years out of a bridge.
From a bridge. So if a family member of yours that's of the age was missing just one tooth, would you always go an implant
Always,
over a bridge?
yeah.
Like no way you would do a bridge
No
on
way.
a family member
No
if they
way.
were old enough.
I think it's butchery. Yeah.
Okay,
So I can't even remember the last time that we had to buzz down adjacent teeth. We just don't do it. I personally, I don't think I'd do it anymore.
But bridges
Randy.
are almost like the #1 procedure across the country,
Yeah,
right?
That's because people need to be better informed about their other options. Yeah.
Now pain though, it seems very painful.
So you think about the bone that implant is being placed into, it hardly has any sensory supply to it.
Okay.
So patients have this picture in their head that this is going to be a long, drawn-out, painful procedure. And the response that I always get was, boy, I didn't feel a thing. Maybe it's a little sore where the anesthetic
Because you're numbing
was
them
placed.
during the
They're
procedure.
completely numb. You could even be sedated. A lot of patients just choose to be sedated because if they're losing a tooth, odds are good they've just had a bad dental history to begin with. But we've done implants on a single tooth. Actually, the front teeth are the most commonly replaced single tooth implants.
Okay.
Often because of trauma. So your brother threw a baseball at you when you were a kid, or you bumped the bedpost while you were horsing around with your sister. It's oftentimes a sports-related injury.
Okay.
And maybe that tooth has been through a root canal. It's been through an endodontic surgery. It's been through a long list of things. And it's finally at the point where we can no longer save that tooth. You take the tooth out, put the implant in the same day,
that easy?
and you've got your smile restored.